All right, everybody. Dr. Daniel Klauer here. Today we're talking about the AACP annual meeting in October in South Bend, and we have a good colleague, guest, friend, Dr. Ryan Vaughn here. Ryan's going to be one of the keynote speakers, and so we'll jump right into it. Ryan, what are you going to be talking about this year, and what is it that you do, a little bit of your background and training?
Sure. Hey, thanks for having me on, Dan. It's great to see you. I am a ear, nose, and throat trained surgeon or an otolaryngologist, and I am excited to come and speak at the AACP conference about nasal issues, nasal pathology, sinus issues, and then what we can do to treat it medically, surgically, conservatively, and aggressively. The whole gamut will run everything from start to finish. And by the time that I'm done with my lecture, you'll have a great understanding of really what can go wrong inside of the nose and how do we fix it.
Well, I know some of the innovative techniques you're doing and just the streamline of predictable, methodical care. I know I'm excited to see your workflow and how you can teach us how a patient should be able to get through an ENT so we know what to look for in referring doctors. Now, over the years, you've collaborated with dentists. That's how we've gotten to know you. What would you say is something dentists have taught you over your career that you now implement, look at, and share with your patients when you see them every day?
Dan, I don't say this lightly, but my interaction with some of your colleagues has not only changed my practice, but changed my life. The first thing would be the importance of nasal breathing. And quite frankly, in residency, I was taught that we've got two options for breathing, either a nose hole or a mouth hole. Pick one and go with it. And truly, the very first person who pointed out nasal issues on me was Dr. Lynn Lipsky's, one of your colleagues.
Yep.
And in her own funny way, very crassly says, "Oh my God, this is an ENT who can't breathe through his nose."
Yep.
And that day I actually had kind of a splitting headache, woke up with it, worked through the day with it, came to see her just for bruxism, because of course I didn't have any other problems.
Yep.
And she put a mute dilator in. Within 30 seconds, my headache was gone, my neck pain was gone, my posture was better. And I had a couple choice words for her, but essentially said, "What happened?" And I then went down a pathway of trying to figure out what else is going on here. I then was able to connect with some other ENT physicians who are really into migraine and started realizing that nasal obstruction was one of the triggers that we just had not identified yet for migraine.
Yeah.
And so in my practice, I then have started to specialize not only in TMJ, but also headaches, migraine, and all of the many manifestations of an atypical migraine that include things from tinnitus to vertigos to motion intolerance, as well as pain.
That's cool. I'll defend the ENTs in that. Not as a surgeon, you can attest, like, you don't love signing up to operate on a chronic pain patient. So that right away kind of, I feel, puts a little bit of a guard up. But I'm excited for you to share how you differentiate, like, all right, is this a migraine or headache type patient I can help with? Here's the proof and evidence why. And then it's not so intimidating. And I think the verbiage you shared with me over the years, and I think you'll share with us, will help educate the dentist on how to start those conversations to tee up the ENT and to help support them in tackling these patients and not be so intimidated by them.
Right. Yeah, we'll have a lot of fun out there, but for sure, I'll include that stuff in my...
Awesome. We appreciate your time and energy preparing for the lecture. For those who haven't signed up, we've got a ton of great speakers. This is just a brief little showcase. So we look forward to seeing you in a couple months, Dr. Vaughn, and thanks for your time and have a great day.